looked at a deviation, and it was during an audit. It was abroad, and they said, "Oh, isolated incident. We've retrained the operator." So I looked back in the deviation log, and I saw another one with the same name. I thought, let's look at that, and it said it's like 5-6 weeks earlier, isolated incident, retrain the operator. I thought, see if we've got any more. And throughout the last 6 months, they'd had 5 isolated incidents of the same issue, and they'd retrain the operator every time.
Yeah,
and 3 of those retrainings
it's always the human
with the
error.
same operator. Exactly.
Okay.
But it's an easy answer.
It's easy. Just close the deviation, make a kappa, train him, and it goes away.
Yep.
But unfortunately, it doesn't, right?
No, exactly. That's right. So then it comes to somebody doing the trend analysis to say, well, you've got this one, this one, this one, this one. What are you doing about it? But if you're under 1,500, so you're looking at about 120 per month deviations, it's hard to spot those. So you need a system in place as part of your deviation procedure that looks back and says, is it really an isolated incident? Has it happened before and again and again and again and again? And that's quite hard to do unless you go to an electronic system.